There's going to be a big meeting tomorrow on healthcare reform, finding a way to alter our healthcare system with a hope of reducing costs. Now, the hope on the part of many who are going to be a part of this meeting is to have the government take over our healthcare system, to make it like Canada's, like the UK, like Cuba. This is the greatest testament in the world for why it shouldn't be done. And this comes from Newfoundland, of all places, the premier of Newfoundland, one of the provinces in Canada. And unapologetic Danny Williams, the premier there, says he was aware that his trip to the U.S. for heart surgery earlier this month would spark an outcry. But he concluded his personal health trumped any public fallout over the controversial decision. In an interview with the Canadian Press, Williams said he went to Miami to have a minimally invasive surgery for an ailment first detected nearly a year ago based on the advice of his doctors. So his doctors were saying, you really ought to go to the U.S. to get this done. You don't want to die. We have better health care. We have them because we do have choice. We are not under the thumb of the U.S. government.
Better.
We don't go to something like the DOT to get licenses and everything. We pay more for it, but we have better health care.
We also pay our doctors better.
Yeah, we certainly do. He says, and well, we should. Doctors, especially specialists, spend 10, 12 years perfecting their craft or learning it, and then they have to perfect it after that. But to quote Williams, he said, "This was my heart, my choice, and my health." He said, "I did not sign away my right to get the best possible health care for myself when I entered politics." That's the key. I mean, that's something that they ought to just blast out there tomorrow when they talk to President Obama, who wants to put the entire healthcare system under the U.S. government. There needs to be reform, but it needs to be incremental. It needs to be do this, do this, do this, this. You don't just say, hey, we're going to take the whole healthcare system, the best in the world, and obliterate it and put it under the federal government. We're going to let the government take it over and eventually run the whole thing like everything the government does.